All right. Mr. Strauss, right? Strauss. I'm sorry. Can you tell me your first and last name, please?
Mikey Strauss.
Mikey Strauss. Michael or Mikey?
Just Mikey, bro.
Okay, got it. Date of birth?
1/3/83.
83. So you're 39 years old. Is that right?
Can't do math, man.
All right. Sorry, man. Just want to make sure.
42, bro.
42. All right. Thanks, Mikey. So really quick, man. Well, we'll just start here. Can you tell me how you got here today?
Look, got arguing with my wife. Neighbors got involved. Before I knew it, yeah, I guess I'm yelling at the cops or whatever because they're dicks and whatever, man. They brought me here.
Okay. Well, I appreciate you being honest and telling me that. Again, I understand it's not, the best thing to be arrested, when you have an argument at home. So let's just get through these questions and then so we can move forward, okay?
All right, man.
So really quick, are you suicidal?
No.
Not suicidal.
No, that's
okay.
crazy.
All right. Again, these are just questions that I have to ask. I'm not making any assumptions or inclinations. This is just part of our process, okay? How about any homicidal thoughts?
What does that mean?
Basically, how you have any thoughts of hurting anybody?
Killing cops, them? Yeah. I mean,
okay.
Geez, they brought me here.
Yeah.
I mean, I want to write that down. I don't want that to go on my record.
No, that's
I'm
fine.
not looking to kill anybody. I'm angry.
Okay, so
would you want to be locked up?
Absolutely not. This is a confidential assessment. Again, everything that is said is for the intentions of helping you. Now, I do have to say that if you have an intention or a plan of hurting yourself or somebody else, we take that very serious because we obviously don't want that to happen.
Okay, no, I don't want to hurt anybody.
Okay, that's
to
fine.
Be clear, I don't want to hurt anybody.
Okay, so I'm gonna ask you just to take a deep breath, relax. That way, because I don't want you to say anything that you don't mean.
All right.
So, I'll just ask you again. Are you feeling homicidal? Thoughts of hurting yourself or anybody else?
No.
Okay, thank you. Do you have any auditory or visual hallucinations?
Like I hear things?
Yeah, things that others might not hear.
No.
Okay. Do you see things that others might not see?
No, man, I'm not crazy, dude.
Okay, that's fine, man. So then I'm going to, considering that you're not suicidal, I'm going to skip over the questions of suicide intention. You're here for another reason, but I will ask you is, have you ever had any prior attempts of suicide?
No.
Okay, all right, just asking. Okay. Really quick, do you have any access to guns or weapons?
I mean, yeah, I do have a gun.
Okay, like your gun or?
Yeah, it's my gun.
Okay, sounds good. Do you normally carry that with you? Do you?
No, I mean, it's locked up in the safe. It's just for self-protection.
Okay, all right, sounds good.
I don't hunt. It's just.
I know. I know we live in a state where
Yeah, I mean,
it's fine.
I can't remember the last time I pulled that out, honestly.
Okay, good. What's your current living situation like?
What do you mean?
Like, where do you live?
I live in Las Cruces.
Okay, you live in an apartment, a house?
Oh yeah, no, we own our home.
You own your home?
It's a townhome, but it's
okay,
home.
Good deal. And you live with your wife?
Yeah, my wife.
Any kids?
Yeah, 2 kids.
2 kids. Congrats. What are the ages of the kids?
My daughter, she's 13. My son's 12.
Okay, sounds good. Do you feel safe at home?
Yeah.
Okay. I'm sure your kids and your wife feel safe.
Why wouldn't they?
Well, the only reason I ask is because obviously PD brought you in.
It's just an argument. You ever had an argument with the old lady?
Absolutely, man. But the truth is that, there was it's a domestic case.
I didn't hit her.
Okay, but
punch some walls. I'm not allowed to punch some walls. Frustrated, man.
Okay, that's fine, man. So, you understand why you were, arrested and brought in, right? Because usually at this point, if cops are able to resolve things out in your home, it doesn't require for you to be brought in. But you were brought in for a reason.
It's exaggerated. Look, me and my wife got into a fight. It happens sometime. I drink. I don't drink a lot, but I drink. Punching walls, making a ruckus. Sure, kids were crying. It probably got dramatic. I get it, but these neighbors, they don't have to get involved.
Yeah.
And they call the cops. Before I know it, they show up. I raise my voice at them.
Okay.
I didn't want them coming into my house. I don't beat my wife. I don't beat my kids. It's just a rough day, man.
Okay.
Rough
All
day.
right.
I had some hours I expected to work, and they got cut because, everything's getting cut now. And, yeah, dude, I'm stressed.
Okay. Again, I appreciate you being honest with me and sharing this with me. Just to reiterate, there's never been any issues with violence towards any of your family members.
I mean, I yell. I won't lie. Yeah, I yell, bro.
Okay, cool.
Fair enough. That violence? I don't know what that constitutes.
Well, here we're, not here to determine, like legal issues. We're just here to be factual. But
Okay.
you're telling me there's never been any violence.
No,
I'm gonna
never.
take your word for that. Okay.
Yeah.
What do you, as far as occupation? You work? You student? What do you do?
No, I don't go to school, man. I work for TechStat.
Got it. So full time,
Yeah.
Monday through Friday type of job.
I mean, if I'm here any longer, I might lose my job.
Okay. Well, our goal is to get you home. So, as long as we determine that you don't need to stay here, which doesn't seem like why, but why you would stay, but we do want to make sure that we get you the help that you need. So our goal here is to.
I'm gonna stand up, man.
Okay, that's fine. You can stand up, man. Our goal is to discharge you with the plan so you can go home safely. Okay. So let's continue with this.
All right.
Tell me a little bit about your support system.
What does that mean?
Like, aside your wife and your kids, do you have family, friends? Are you social?
I mean, yeah, I have my buddies.
Okay.
Got my brother. I mean, got the wife and kids.
Okay, sounds good. Any history of mental disorders in your family, on your parents? Your parents' side, mom or dad?
I don't know. I think my mom has anxiety.
Okay.
She takes one of these pills at night to help her.
Okay,
sleep.
sounds good. What about dad?
I honestly don't know much about him, man. He cut and run a long time ago.
All right, man. Well, I'm really sorry to hear that. Have you ever been diagnosed with anything, any medical issues, anything at all, any official diagnosis from a physician?
I mean, I got chronic back pain from when I was in the military, like some shoulder pain. That's about it.
You said military?
Yeah, but I'm not now.
All right. How many years did you serve?
14.
14. Okay. We'll touch that in a little bit, okay? So, your sleep, how's your sleep like?
It's good. I mean, I sleep.
How many hours a day?
I don't count, man. I mean, I go
More or
to,
less? I mean,
I don't know, like, I go to bed at 11 or 12, wake up at 6.
okay,
whatever
sounds
that
good.
is.
All right, roughly, okay, 7-8 hours. Are you currently taking any medication, supplements, anything over the counter?
I mean, I take Benadryl to help me sleep sometimes.
Okay.
I mean, I just take a sip of it, I guess. I don't know, a swig of it. And, I mean, Motrin, lidocaine patch. Like I said, so I gotta stand up, man. My back hurts.
Okay, sounds good. Really quick, aside the Benadryl, the Motrin and lidocaine patch, any other drugs? I know you mentioned alcohol. Can you tell me a little bit more about that?
Come home, our day, a couple beers.
What does a couple of beers mean? If you had just a ballpark figure, how many a day? How much do you drink a day?
I mean, just the guys get together at work, go to the bar before we head home. So, I mean, I'll probably buy a round or two, so maybe 3 or 4, something like that. I buy a round, that guy goes around.
Okay, sounds
something
good.
like that.
So typically, I mean, I know, one beer is kind of, either 20, 22 ounce.
It's a regular bottle of beer.
Regular bottle. Okay, so let's say 16 ounces. How many of those would you say, like when you go out? You say a couple rounds, so is that 4?
Yeah.
4 a day?
A day, okay, yeah, maybe a little more on the weekends because it's the weekend.
Okay, so let's just say in the weekend, maybe a little bit more, maybe double. So 8 on the weekend. Yeah? Would you say that's accurate, fair?
Probably finish a 12 pack.
12? Okay, so 12 pack on the weekends. Got it. Now, is this, and I know this is, difficult to ask for me because, I don't want to impose, but again, we're here for an obvious reason. So, you would say you drink every day?
Yeah.
Okay, sounds good. Have you ever had any issues because of alcohol issues? For example, any DUIs, any domestic violence, any?
Yeah, I've had a DUI, but I was like 22, dude.
Okay, sounds good. as far as also staying on the subject of alcohol, do you have you ever had any issues like missing work, not going to work, um, any other type of issues related to alcohol use?
I mean, I've been hungover at work before, but I mean,
Okay.
no, I don't.
Whatever makes you more comfortable. So really quick, so you said hungover at work.
Yeah, but never lost a job because of it.
Okay, all right, good deal. So how old are you when you first started drinking?
I was in the military, so whatever, 18 when I graduated.
So basically started at 18.
Mm-hmm.
The daily drinking, how long would you say that it's been going on for?
Since I got out of the military, so maybe 6 years ago.
So 6 years ago, and you would say every day
Mm-hmm.
for 6 years ago. Okay, sounds good. Again, I appreciate you being honest. I know this is not easy, but it's always with the intention of being able to get you the best care, okay? Any allergies to any medications or food?
Penicillin when I was young.
Okay.
Told me I had a rash, but I mean, I've taken stuff that has it and I don't really break out, but so they told me when I was young.
Okay, all right, sounds good. Nicotine use?
I mean, not all the time, but sometimes I
Occasional?
have a cigarette when I drink, yeah.
Okay. When you drink, so does that mean if you drink every day, do you smoke every day?
I guess so, yeah.
Okay,
But
sounds
I
good.
don't finish a pack or nothing. I just
Just a couple cigarettes
yeah, I
a
mean,
day. Okay, all right. Any other drugs that you smoke? I have to ask this, but any cannabis, any fentanyl, any meth, any other drug use?
I mean, when I was before I was in the military, yeah, I tried some marijuana, like I smoked some weed, but I don't do any of that stuff.
Okay, all right. Thank you for sharing that. Um, we've established, obviously recent drug use, alcohol use, but what is the most recent use of any other drug that is not alcoholic?
No, I don't use drugs.
Okay,
No.
sounds good. Just prior. Do you currently have a primary care physician?
Yeah, I go to the VA, bro.
Okay, sounds good. When was your last visit with your primary?
Probably last year.
Last year.
I had this pain in my groin, and I don't know.
Did that ever get resolved?
I mean, it went away on its own, so they want to send me to a urologist and all this other stuff like that. But
Okay.
I ain't got time for that. But
All right,
it went
fair
away,
enough.
so I'm okay.
Will you I'll actually take this opportunity to do a quick physical assessment on you. Would you be okay with that?
Sure.
Okay. Alright. So, Mikey, thank you again for that. I think there might be some medical concerns here, but I don't think that that's for right now at this moment. But I think there are some concerns, especially related to your groin, that you might want to consider taking a look at. I understand you might not have the time, but it's important, just keep this in mind. If any medical issues get worse, you can be out for an extended period of time, which could also cause, further delays for you at work. So I think it's better to be proactive and prevent things instead of putting them off, okay? And that's just my medical opinion. Take that for what it's worth. Now, have you done any therapy, any type of psychotherapy or?
No.
Okay. Have you ever gotten any treatment for anything, including alcohol abuse?
No, I don't do any of that.
Okay. So the reason why I say that, it's because, again, I'm taking the liberty to, be very frank with you and honest. It's important that I'm transparent based on what I'm hearing. It seems like alcohol abuse is a diagnosis that I like to
Yeah, I
basically.
mean, my old lady wanted to send me to the church to give me some stuff, but I mean that's not therapy, right?
Well, I mean, there's different types of therapies. There's different modalities, but again, one of the most important things about all therapies is that it requires your participation. Okay. Therapy is only going to be as good as you are about doing therapy. So just keep that in mind. Let me ask you, what is it that you would want to? How can I best help you today? For example, what do you think that I could do to help you get better and
Explain to me why I'm here. I don't know why I'm here.
Okay.
I mean, I don't want to hurt myself. I don't want to hurt other people. I guess I yelled, and okay, I drink.
Okay.
I mean, but do I need to be here for that? Like, so whatever you can do to get me out of here sooner, because I start work on Monday
Okay.
and it's Saturday. I need to get out of here by Sunday. How can I call my boss and tell him I'm stuck here?
Got it.
I
So
lose my job.
okay, so to answer your question is you don't have to stay here. You're not suicidal. You're not homicidal. You don't have any issues that warrant you staying here. So you'll be discharged by today. However, part of our psych evaluation is that I do my job in providing you with the resources and the options to basically get the care that you need. You're not mandated to do any of this, but considering that we're here now and we've had this issue with the cops bringing you, it's an opportunity, to take this serious. So one of the things that I would highly recommend is therapy. It's very important to start talk therapy. There's different options. There's group therapies. There's individual therapy, and that really depends on preference. There's there's group meetings for Alcoholics Anonymous every single day all over town. You can find that easily on the internet. We also will provide you with a couple of resources.
All right, I'll take it.
So we'll provide that. As far as medications, that is something that I will want you to follow up with the primary care. Here our primary focus is to make sure that, again, there's no acuity that warrants you stay here. I don't want to prescribe you something like an antidepressant that it's going to require follow-up, but I would highly suggest that you consider following up with the primary. It's really difficult, to diagnose depression in this current state because it requires a lot more thorough assessment, and so I just want to make sure that we address the priorities here, which is, I think, the alcohol abuse. Okay. You think that sounds like a good plan?
Yeah, I mean, I probably gonna need to come back. You're not the first person to tell me this.
Okay. All right. Well, that's good. It's a start. I think that again, it's important to be able to recognize what the issues and the challenges are to be able to address them. But I think that this is a good thing today, right? So you have a family, you have a wife. Sure, you have stress, and I know the world isn't easy, but there's a lot of good things that you have in your life, a lot of positive factors, and I think taking some time to reflect on that is good. But also, again, there's tons of help that is available, and this is something that you can start to work on immediately. So, okay. There's a saying, slow is smooth and smooth is fast. I always like to tell my patients this. This problem didn't start overnight. It's not going to get fixed overnight, but you have the support around you to do it. So I hope that you take advantage of that.
I will, man.
Okay, sounds good, man. Thank you for your time. Appreciate it.